money that I collected. It's honorable that brought
Destiny of Nigeria.
Contribution to Nigerian peace.
Me, I want men, all of now look at this.
But there comes a time when you want to take steps every day to make this country a better place.
And the new Nigeria is our
Education is telling them it's time to change.
Hello and welcome to Ground Zero. Ground Zero is a program where we pick up topical issues in the polity and bring them to the fore, analyzing it and basically explaining them and giving you a better understanding of these things. And today's edition of the program is one where we will be commemorating the International Universal Health Coverage Day, which happens to fall on the 12th of December, which is today. Now, giving you a little bit about the Universal Health Coverage and what it stands for. On the 12th of December 2012, the United Nations General Assembly endorsed the resolution urging countries to accelerate progress towards universal health coverage. The idea that everyone, everywhere should have access to quality, affordable health care. On the 12th of December 2017, the United Nations proclaimed 12th December as International Universal Health Coverage Day, UHC Day, by Resolution 72/137. The Universal Health Coverage Day aims to raise awareness of the need for strong, resilient health systems and universal health coverage with multi-stakeholder partner. And this year's celebration was commemorated by the Save the Children in Nigeria, and in Kaduna State today, there was a public dialogue in commemoration of the Universal Health Coverage Day 2023, where partners were brought together to discuss these issues. And on the program today, we'll be looking at some takeaways from the event that was organized by Save the Children International. The first presentation that we'll be looking at on the program today was one by children from Kandik School, Kabala, Kaduna, where we have Khadija Haruna, Nana Aisha Kabir, Fatima Adamu Garba, and Santos Stephen, with this presentation titled From Children to Policy Makers, What Universal Health Coverage Mean to Us. Listen to this and watch it.
My name is Khadija Haruna. I am here to talk about childhood as it affects our existence and our future. According to World Health Organization 1948, health is the complete state of physical, mental, and social well-being, not merely the absence of diseases or infirmity. This definition therefore means that a healthy person appears able, fit, and healthy. A healthy person thinks and acts right and accurate. A healthy person is low, with high self-esteem. A healthy person lives good life and dies a natural death. If you imagine the opposites in the above points, then you can relate it with an unhealthy person. Specifically, Children's Center for Pediatrics focus on the well-being of children from conception to adolescence. It is basically concerned with all aspects of children's growth and development, all road to adulthood. Every adult was once a child. All the adults here today escape child mortality. Others, with millions of others who not escape it. Today, they are gone and forgotten. We are crying out today that our parents do not need to treat or cure us of diseases, but prevent what could eventually be cured or treated. The government and the world at large should prevent illness, but should promote good health for us to be able to survive. Prevention, they say, is better than cure. The health of children is so important because by the basic resources of the future mankind, the consequence of any society depends on the succeeding generations. We have always heard that we are the leaders of tomorrow, but our existence is tempered by polio, measles, chickenpox, skin infection, bronchiolitis, hemophilia, malaria, tuberculosis, diphtheria, and lots more. Many children around the world have of the universal health coverage. Over to you, Mama Aisha. Good day to you all. My name is Nana Aisha Kabir. I want to talk about the importance of child health. Health is of course very important to us because it is the foundation of all growth and development. Our health includes more than physical growth. Some other important parts of our health include cognitive learning and thinking development, social and emotional growth, and mental health growth. Health is a very rich source of data for studying and learning. The relationship between health status and learning ability of children is so close that an unhealthy child can neither go to school nor do well in class during lessons. There was a case of a school girl who came to school with 8 friends, but vomited all through the first and the second period of lessons. When a test was conducted for her, she was diagnosed of diarrhea. Another case was that of a pregnant couple who was taken up by malaria fever. That later took his life because the parents were using local herbs due to inability to access health facilities. From these two cases and many more among the school children, how can they tap into their potentials? Some had chronic health challenges that lead to their information, which have taught some to developing low self-esteem. The importance of healthy children cannot be overemphasized. Healthy living helps the kids have more energy, maintain a healthy weight, avoid illnesses, and feel good about themselves. A healthy lifestyle includes eating healthy food, but how many parents can afford that now? Like eating plenty fruits and vegetables, as well as whole grains and limiting sugar and saturated fats. A healthy lifestyle also includes being physically active and getting enough sleep. Like moving your body in ways that will make the heart beat faster for at least nation. Thank you all. Over to you, sir.
Good day, everyone. My name is Santos Steve. I'm here to plead the government to hear the voice of the children. To conclude the discussion, inadequate health is usually universal in all countries, and no country has the perfect healthcare system, but it can always be improved upon. Health is our basic human right, and improvement on it should be the goal of every country. As such, improvement on it should be the goal of every country. As such, improvement in healthcare and a sustainable healthcare system like public primary healthcare system will provide quality care to all citizens, and this should be a primary goal. Nigerian government should help us survive and sustain life. Some of our recommended calls to action are: the government should help prevent the spread of diseases, make available the appropriate vaccines to help keep us alive. The government should help us provide first aid boxes in our schools and our PHCs in order to do well in the schools and in the society. The government should help our parents to feed us with balanced diet by reducing the cost of goods in the market. Partner with the appropriate agencies to help support when necessary. Price of drugs and medicine should be monitored and reduced so our parents can afford. Parents should allow their children embark on physical exercises to help keep them fit. Roads leading to rural hospitals should be accessible and motorable to prevent mortality. Private healthcare centers should be spread across localities and communities to then function well effectively. UHC should not only be written but a reality. Thank you all for having your time to come here to listen to our appeals to the government and relevant agencies. May God bless you all. Thank you.
Please take a sounding round of applause for this feature.
That presentation was by pupils from Kamlik School, Kabala, Kaduna. The next presentation would be from representatives from the Kadman Academia, NHIA, SPHCB, and Kachma, and of course, Save the Children International. And they'll basically be looking at optimizing health financing, sustain the gain, and push for progress. Let's also listen and watch them.
I am Dr. Farooq Abu, representing the Chief Medical Director, Hospital. I think rather than that, I would like to pay credence to what the panelists have said. They have tried so well addressing the demand side. Beautifully, I accept that. Thank you. I want to commend the presenter, Madam Yakubu, for his presentation. He mentioned the Abuja Declaration. And I tried to summarize the presentation. We saw that there was a problem at the point of access. People don't get commodities. We saw that because government does not provide even that 15% coming, so beneficiaries have to pay more. I also realized that from the presentation that those who pay more are willing to pay more for insurance, showing that there's willingness. However, there was a problem of what? Reimbursement. Problem of reimbursement means that when they try to access service, they don't get it there. You pay out of pocket, bring the receipt from maybe retailers outside, private sector, and then you go to any child or whatever, and they tell you that they need government receipt. And it becomes a bottleneck. bureaucratic activity. So that trust is advanced. So what do we do? I noticed also from the presentation that all these problems that were mentioned are surrounded around that 15%. 15% that was decades ago after the COVID-19 we want to forget about. How much is that 15% in this already millennium? It makes a joke of everything in my own opinion. So that 50% is an understatement. Two, you look at all the problems that were mentioned, they seem to be external to our passive beneficiaries, common man. Look at the problem of inflation. Look at the problem of economic downturn. Look at the problem of insecurity. Look at the problem of maldistribution due to social inequity and inequality. Our political lack of will. And even change of government can affect the program. And then the Almighty out of stock. What am I talking about here? That healthcare financing and the health system does not operate about one commodity only financing. There's a component aspect. I was very happy last year when NHI at the national level started to engage the private sector and were big conglomerate pharmaceuticals in the production of commodities. But I noticed there is a trend, a worrisome trend happening because of the bad economic environment. They are pulling out. Look at Procter & Gamble, look at Pfizer, look at GST of recent. Why are we letting them go? So, my advice, in my opinion, is that in order to address all of these problems, including our lack of stock, which is a problem at the point of source, we should rather subsidize intervention, subsidize production, and not consumption. Let our companies stay. And send it down from the national to the state. We used to have Zaria pharmaceutical in Zaria. You could get syringe here. And where is it now? So without solving that supply side, finance is one I agree, but also the commodities for everything. I think I should not practice this discussion longer. I've made students models.
Thank you very much, Doctor. You know, you asked a question to his contribution and question, and I think that is actually very, very responsible. All right. So, Dr. Mary,
good afternoon, panelists. Good afternoon, everyone. My name is Ibrahim Hassan. Incidentally, I'm saying my mistake. I've never meet you personally until for the first time. But I've heard so much about you from my left friend that I know you. The left friend and colleague. Incidentally, my mom is looking at you. So, good afternoon, and happy to meet you. Going to the business proper. All my personal observations are the low-hanging fruits I'm touching from our children's presentation. One mentioned the Indian example, Indian situation, where country has say 35% of a population of over 2 billion, 35% children under the age of 15 come into the wave of not fully healthy. Today we have a similar, and I wanted to respond that is going no problem. Today we have a similar situation in Nigeria. Somebody just mentioned that it's a brother of IUIK is not an elitist community, it's a mixture. Today in my community, virtually 70% of households cannot feed their children properly. I'm talking from experience, and some of us that are feeding our children properly are even doing it secretly, private, so that we will not be late or we will not attack us in the house. I want to assure these panelists, I'm happy government officials are here, that virtually most of the school-going children in this age, that are children as in India, are not within the wake of inherent situation. Please, I'm not an analyst, but I have to tell you the reality. We are having a similar situation in Nigeria and in Kaduna, my unit of analysis in particular. That's number one. Then I also want to link my question to what the Forum for Sedition is actually mentioned. It's unfortunate that our politicians give more emphasis to infrastructure development, not instead of human development. Recently, I was at a workshop organized where the former chief of Niger State came and spoke. He said people like building bridges where bridges are not necessary. Well, I should move further so that we don't politicize this discussion. But actually, I want to ask the government officials that are here and the politicians that are here perhaps to tell us why are they not so caring, looking at what I've just mentioned earlier about the state of our children. Their God has been started. A lot of them can't even go to the hospital. 2 days ago, someone came to my house. In fact, I asked my wife to give them food first. When I took them to the hospital, saw it to the private clinic, I spent about one. I spent some money I shouldn't discuss it. Then the attendant, the local doctor in the community, told me that why they came down here. So this is just, if I sound, this is just what is happening actually most of our community. So I think I wanted to answer Dr. Ibrahim. There is also this certain, I call it immediately because it was Wonderwood. It's now, I don't know, in my community it is there. So I wanted to ask him, well, he belongs to the protest sector, then how does she go to the government headquarters? What are you doing to curb this? It's contagious for because it's spreading. So let me respect this. Thank you very much.
Thank you very much, Asanta. I welcome Mr. Southern High Energy. You know, you really do some community. Number 3. I think the breakfast has come around. The place, except for those of the panelists.
My name is Chairman now. My questions will be directed to Kachman and Lady Kachman. But before they end, I appreciate the panelists for the job well done. Thank you for the insights you've given us. Kachman, when you were talking, you made mention that the 3% counterpart from the government side is not coming. Actually, I was confused. I want to ask, is it that it is not coming completely or it's not consistent? Because I was surprised that the government that brought up a policy is not able to provide our own part of funding for that program. The next question will be to both Kachman and Kachman about the mechanisms that are put in place to ensure that some of the provisions made to the primary health care centers, the money sent there or the drugs that are purchased and distributed to the primary health care centers. What are the mechanisms put in place to ensure that either it is money that is sent for drugs, that they are used for the purpose they are meant for? When you discover that as an enrollee, sometimes you go there and you get their amounts. Sometimes you have maybe malaria or typhoid, and they tell you the only thing you can get here is paracetamol. And if I'm contributing maybe 10,000, 12,000 every month, and you are telling me that the only thing I can get here is paracetamol, and if I can buy paracetamol, a good product, I don't know what I'm talking. So you look at my contribution and what are we able to get from the primary health sector where I live. So what are the efforts or mechanisms that are put in place to ensure that there are no abuses those of us that work with the government, we have direct relations. So whether you are interested or not interested, you are a role by force. So what are you doing about those in the private sector? What is the campaign? What is the membership drive towards those that work the private sector, the market women, and even those that are artisans and are not you understand? Thank you so much.
Thank you very much. Can we go to number 4? Yeah. I'm sure the questions are noted. Kashma, I hope in the next 10-15 minutes you should be out of here.
Thank you very much, everyone. My own is no more question. I want to comment. Looking at the submission that Kashma made, for us as a program there are initiatives that we are taking that guided priority in some territories on ethical health financing. Because for us to build a strong and resilient health system that will contribute to the achievement of universal health coverage, we have to come up with initiatives and innovative ideas to complement the informal sector. So we are piloting ethical health financing in about 15 LGS of Kaduna State. So I want to use this opportunity to seek for more collaboration so that we work together as a team with the private sector and the Kaduna, including the state research and working with the NDC, so as to improve the enrollment of informal sector in Kaduna State. Thank you very much.
Thank you very much. We realize that every speaker keep talking about the issue of doing away with confrontation. The areas of being confrontation with government is over. Now we have to work as a team to ensure, because we're talking about that. They said an healthy society is a wealthy society.
So thank you for your questions and observations and comments. So to start with, there was a question pertaining to the 3% counterfactual from the government. Well, I'm sad to tell you that contribution has never come. So it's only the civil servants in the state, that's the formal sector, that are making their own contribution of 3%, which comes directly from source. Before you even get your salary, that money is deducted. We have never received contribution from the government with regards to that. Then the issue of drugs being purchased. Kachma does not purchase the drugs for the healthcare facilities. Rather, Kachma pays monthly capitation to the facilities, and they have what they call a business plan. They have a quarterly improvement plan, they have an annual improvement plan and a quarterly business plan. And in this quarterly business plan, they take into consideration all that they need to be able to provide the quality services that are required of them. And one of that is essential drugs. And Kachma has mandated them to use the capitation which has been given to them to purchase these drugs from the Kaduna State Health Supply Management Agency, formerly called the DMA. So all healthcare providers or all healthcare facilities are supposed to get their drugs from the central store. So Kachma only provides the funds but does not make them go and get it or get it from them. Then with regards to addressing issues of concerns or complaints, we have a call center. We've tried to publicize our call center contacts. We've reached out through sensitization of the different groups. We've had various town hall meetings with union leaders, religious leaders, market leaders, community volunteers, and so many different aspects of the residents of Kaduna State. We've engaged them at different levels, trying to tell them more about the Kaduna contributory health scheme and trying to get their buy-in. So during such encounters, we give them all our contacts so that they can reach out to us if they have any complaints, maybe they have any issues at the facility when they go to access care. They reach out to us. We have an enforcement team that immediately swings into action, goes to these facilities to hear from their own end, because we don't only listen to one side. We listen to the person complaining and we listen to the person they complain about and try to resolve issues as soon as we can. Then with regards to informal sector enrollment, that is what Kashma is driving at right now. While William was talking, he mentioned one of our supporting partners who assisted to register about 10,000 vulnerable people. This they just concluded, I think, a week or 2 weeks ago across the 3 senatorial zones of Kaduna. And we're happy with Chime for that. And we're hoping that other supporting partners could assist Kashma in that. Because remember, I said it's all about the numbers. The more numbers we have, the more money we can have, the bigger the pool, and the more services can be rendered, and the more people can access these services. And at the end of the day, universal health coverage can be attained. So we're doing everything possible. Also, Kashma is engaging with the revenue generating agencies in Kaduna State. We're hoping that if everything turns out well, for you to renew your driver's license, you have to show one form of insurance, to show that you belong to one insurance agency or the other. For you to get married, you need to show your insurance that you're registered under one health insurance or the other, amongst others. Let me not tell you everything now. As they unfold, you'll get to find out. So yes, Kashma is not resting. They're doing everything possible to get the buy-in of the informal sector. Sando's category of people you were describing, they're called the informal sector. So those that are not under the government workers are the formal sector, those other are the informal sector. And everything Kashma is doing right now is driving at enrolling the bulk of them. And I think our population is about 10 million, if I'm not mistaken. So imagine if, let's say 5 million of the residents of Kaduna State are enrolled, and they pay their 10,650 naira, because for the informal sector, their premium is 10,650 naira once a year, just once a year. And with that amount, if a woman requires CS, she can actually have CS. And as my senior colleague mentioned, the bulk of our Kashma enrollees are registered in private facilities. You would all agree with me now that to perform a CS or to do a CS in a private facility, we're talking hundreds of thousands of naira. I'm happy to tell you that many Kashma enrollees who do not even have transport to go to the hospital have been able to have CS under the Kaduna State Participatory Health Scheme. So I think that counts for something. Yes, there is room for a lot of improvements, and Kashma is not resting. The authority is not resting. They're doing everything possible to drive the informal sector to key into this scheme. So I'm hoping I have answered your questions, and if I've left anything out, please let me know so I can revisit it. Thank you.
Thank you very much, Dr. Benani. This showing one insurance before you get married. These boys are getting begging to get married. I hope this will not contribute to. All right.
She said that soon Kashma is collaborating with revenue collecting agencies to make sure that everybody has enrolled in health insurance. I want to inform us that nationally, health insurance is now mandatory. It is mandatory for every citizen and legal resident of Nigeria to register with one form of insurance another. That is why we are at the national level trying to bring the whole health insurance ecosystem under one roof. We have done that, we are just finishing touches so that we can monitor and see. And like you said, once government comes up with the policy to start imposing, it's going to hamper a lot of activities for people. So my advice is, please, you can walk into any health insurance agency, either at the state or the national level, and get ourselves and our dependents registered.
Please, I'd like to add one important point. So with regards to the informal sector, we have also engaged the Farmer Association. You agree with me that they're a large body. So they have agreed to key into the scheme, and payments can be made instrumentally. They can even use their produce as a form of payment. So you can see that Kashma is actually flexible with engaging the informal tax rule that you must pay that whole sum at one time. You can pay in installments, and you can use your produce as the equivalent of the amount to pay for your premium. So these and many other steps Kajma has taken to improve informal sector employment.
Thank you very much. I want to respond to one of the question here is in terms of service delivery for performance, where you talked about drug stopping. Even at the permanent care board, we have readiness address system in place, which will be part of their service charter, whereby numbers of key executive officers are being displayed at the facility level, whereby any client that visits this facility and you are not satisfied with service provided, you are mandated to call that line and information the address within 24 hours. Thank you.
Thank you very much. And I think we'll leave it here. You know, when I was talking, I keep telling you this contributory health scheme, it's like donating blood, like I always say. If you are healthy, you are not assessing. You are aiding somebody who is not healthy and assessing. And only God knows the reward you will get at the end of the day. When you donate blood, you don't know who will need that. It might be someone very close to you who might be in an emergency situation that might actually need that blood. And when we think about these things sometimes, we might not know the importance. I don't think we ever find ourselves in a situation where blood, just a pinch of blood is needed. And maybe that blood group is not available, then understand the importance of blood donation. So I think the same thing is the case with this. You know, it's just that when you insure your car and something terrible happens, if you know, it's just like you go to bed, okay, I've insured it, and the insurance company can clear everything. But when you don't, and you know, sadly in our life, we use millions of naira to build houses, few thousands to do drainage in front of our house. We are waiting for the government. We use millions to buy car, just few thousands to put security in it. We don't. So the same thing it is in fact. We use our health to struggle on daily basis to source so much money. Then we end up spending the whole money again to take care of our health. You know? Alright, and then we'll take one person there. You come to the stage. You know, instead we go to him. He was busy taking breakfast, we were taking numbers.
Right, thank you very much. And you just touched one important aspect that I think we try to see our focus, which is to catch that, which I don't know what you are doing in respect of that, which is integrating the blood service into the Kaduna State contributing scheme. You agree with me that so many people are finding it very difficult to access blood. Currently, the access fee for blood is 15,000 dollars. I tell you for free that most of these people find it very difficult to pay for that blood access. And this time happened 2 months ago. The woman came for 2 pints of blood, and those 2 pints of blood for her daughter that was undergoing labor. I think she had severe bleeding and she needed to be transfused immediately. And when she came and they told her that you have to pay 20,000 naira, you could see the agony in that woman. To cut long story short, I think they went to Ghana money because when they brought the money, it was 5 naira, 10 naira, 15 naira, and it was still not complete. But his staff from the commission had to complete that money. Now I think it will be very important if the Kaduna State could have to look for how to integrate this blood access scheme into the health organization so that it will reduce the money that this less privilege go through when it comes to accessing blood. Just for that, I said that it's important for the organization.
Thank you very much.
Thank you for your observation, but I'd like to inform you that in the benefit package, the Kajma benefit package, the authority actually sponsors blood transfusion. That's one policy year, or 1 pint of blood per policy year. So Kajma actually can pay for blood transfusion for every enrollee once in a year. So that still takes us
wanted to improve and increase the services contained in our benefit package, meaning Kajma will be able to provide or sponsor blood transfusion for more than 1 pint per individual. So it still comes back to the resources, but it actually covers. It's also blood transfusion for 1 pint of blood for 1 individual in a year. So in a family of, the principal, dependent, the spouse, and 4 dependents, that means Kajma can sponsor 6 pints of blood for that family in 1 year. Do you understand? Exactly. They are aware. It's in the benefit package. Except she's not registered under Kajma. But if she's registered under Kajma, she's entitled to 1 pint of blood. And so many people have benefited from it. We have issued pre-authorization code for that. This year alone, I have lost count of how many people have issued code for blood transfusion. So all we need to do is increase the number of times for each entity, but it is covered.
You see, to be candid to Kajma is doing more than the resources they need to do. Because just as the comrade was asking in her response, imagine there is no CRM coming from government. It's only what the civil servant are contributing. Now, how much is that? How much is that? It's 3%. So imagine if 3% of 30,000, and you are being given a service, say for example, worth of 10,650. Just leave it like that, 10,650, which is much more than the service that you render in a year. But still, they are giving that service. So I think what we need to do is to be advocate for Kajma. I want to call on corporate. You are the president of a very reputable organization, and people like you are here to be advocate for Kajma, for government to release CRM, because that is what Kajma needs to improve its services. Thank you.
Well, thank you very much. I think for my colleagues in the media, this is also a very good news. The government will release that money. Because, we always talk, government will come and say, where the global listing is certain percentage of budget we are doing that. By the end of the day, how much of that money is released? How much is cash back? At the end of the day, politicians are very good at that. At this point, I will call on the representation of the Commissioner of Health, because a lot of issues are also raised, which I'm sure you won't want to say 1 or 2 things. After him, I want Hello Ali Hayat, the Special Assistant to the Governor of Student Matters, to get ready. He will be giving us the closing remark.
Yes, I've been listening with deep interest to the conversation and it's ongoing. I have to confess I resisted the invitation of joining the panel, just so I could note this. So I want to state the Kaduna State Government and the Ministry of Health is not just keen on building infrastructure, but also, like I earlier said, improving human capital development, which we all agree consists of education, health, and human services. So we even have a council, the state government has a council on human capital development where all these institutions are brought together. Then for the nutritional status of our children, nutrition activities have been involved to the list of our health centers. With the introduction of community management of acute malnutrition, we all know that relying on donor funds or supplement is not sustainable. So we are putting more emphasis. Our health promotion officers and our nutritional officers are there teaching our caregivers the best way to cater to their children's nutritional health needs with the local available foods that we have. Then for the out of stock, we are in collaboration with Zipline. We all know how Zipline uses technology in delivering most of these commodities to very had to reach communities. So this has helped, even though the facilities are limited, but it has helped to reduce the lag time and also addressing some of the cases of out of stock that we have in our facilities. And I want to assure you all that whatever deliberations has been made here, we're taking note and it will be submitted to the Honorable Commissioner for onward submission and action. Thank you.
And with that, we've come to the end of Ground Zero today, hoping that you had a wonderful time with us on the program. Until the next edition of the program, I'll tell you that remember that universal health coverage is for all. So let's think about health for all. Time for action. Take that action today. I am Ehis Adon. See you next time.
Are you seeking the truth about Nigeria? Look no further than Truth Nigeria, your reliable source for unbiased news and insightful analysis. Explore truthnigeria.com for the real stories that matters, from governance to international politics. Uncover the reality behind the headlines. Truth Nigerians, where facts meet clarity. Discover the truth about Nigeria today. Visit truthnigeria.com now.
The money that I collected is honorable that brought to me. Can we make a contribution to Nigerian peace?
Me, I want make all of now look into this
becomes a time when you want to take steps every day to make this country a better place.
The new Nigeria is education is telling them it's time to change.
All colors, shades, angles, and perspectives can be overwhelming in our present world of information overload. This is introducing Ground Zero. Ground Zero is a current affairs discussion phone-in program covering topical issues in the polity. The program is a platform for an in-depth analysis of trending issues by professionals, authorities in various fields, analysts, and key actors in the polity. Ground Zero gives the listener an opportunity to contribute to the discussion via phone call, SMS, Twitter, Facebook, and Instagram. From the conservatively serious to the ridiculously funny, Ground Zero accommodates them all. Professionals, urban contemporary businessmen and women, policymakers, public service workers, students, artisans, traders, and the in-between. Ground Zero comes up from 5 to 6 p.m. every Tuesday and Friday on Invicta FM and 5 to 6 p.m. every weekday on Procian Radio and Television. Ground Zero is a production of the Procian Media. Tune in.
When news breaks, we break it first.